Everybody, welcome. It's so great to see you guys here. We'll give a few more minutes for other people to join us in case they're running a little bit late tonight.
Since it's just a couple of us, Cindy, Marie, Julia, or Mary Lisa, if you wanted to, if any of you wanted to say what your interest in this topic is, or what you're hoping we talk about, that I'd be interested to hear.
Oh, thank you. Hi, Jennifer. I got my nights mixed up. I'm so sorry.
No worries. I'm glad you could make it, Julia. It's awesome.
I am too.
Yes.
Well, Paul, thank you for asking. I'm just a concerned grandmother, 3 grandsons, 14, I should know this, 12 and 9. And I'm just curious about, what your topic is tonight. Excuse me, I'm getting a cup of tea. I'll be right back.
Good. All right. Marie, Cindy, is there if you're interested in sharing, that'd be great. What you're interested in the topic of gaming.
Okay. All right. I have 6 grandchildren. A 10-year-old. Let me see. 10, 14, about to be 15. 2 17-year-olds and a 20-year-old. So yeah, big family. And they're all into the gaming, and they're always on the tablets. They want to play different games, and I know it's not good for them. And I'm just trying to get some other things. I actually invited my daughter to this too, but I didn't see her come on yet. Of course, she has the kids, so she may not. But it's good to get the information just to back up what I believe. It's good. Sometimes it is good for them to learn on sometimes with some things, but it's not good for them to be on that all their spare time. I really feel that they need to be doing more. I brought them up as readers. They always used to read, and now they're like, oh, but grandma, I'm reading on the tablet. And it's like, no, read a book, and a lot of times I'll check, and they're not really reading on the tablet. So, it's just, I know it's not good for their brains, and I just want to see what the other, with the mental health, that's really concerning to me.
Great. Thank you. Welcome.
Thank you.
I'm here mostly as a participant because I work with youth at the community college, and also as a faith formation practitioner at a church. And just my kids are hopefully aging out of this. My youngest is almost 20, but it's just an important topic that you need to be educated and prepared for anything.
Great. Thank you. Welcome, Cindy.
Thank you.
Good to see you, Cindy. I haven't seen you forever.
I know. Hi, Jennifer.
Well, I'll go ahead. Anybody else wants to say why they're here? Let that go first, and then I'll do the introductions. Anybody else want to tell us what you're looking for tonight? So, welcome. Welcome. So I'm Jennifer DeSimus. I'm the director of the John P. Webster Library at First Church in West Hartford, and I wanted to welcome everybody here tonight. We're here tonight to talk about youth screen time and gaming, and just as you've already sort of touched the tips of the icebergs, I think it's a concern for a lot of us. And I wanted to first give kudos to Hartford Healthcare for collaborating with me on this program. It's a free program, and if you happen to miss, if you want to share this or find other informational programs from Hartford Healthcare, I encourage you to contact them, go to their website, because these are free and other libraries around the state are offering them as well. So I'm so excited that we could partner with them. And so without any more of my voice, we'll turn it over to Dr. Paul Weigle, who's with us tonight. Thank you.
Great. Thank you. Excited to be here and talk about a topic that's relevant to all of us who work with young people, have kids and grandkids, and that's video gaming, screen media, and mental health. I'm Paul Weigel. I'm a child and adolescent psychiatrist. I am the Associate Medical Director of Natchog Hospital, and I'm also the chair of the Media Committee for the American Academy of Child and Adolescent Psychiatry. So this is a topic of great interest to me personally. So did you know that American teens spend twice the amount of time on screen entertainment as they do at school? Screen entertainment has really vastly changed the landscape of childhood and adolescence, and we'll look into how much and what that means. So yeah, going to talk a little bit about how much time is become typical, why screen time has come to dominate the free time of so many young people. I'm going to focus on video games. I heard some about some boys and grandkids. So I'll talk a little bit about social media as well, and talk about the mental health effects, both bad and good. And there certainly are good. Not here to necessarily preach doom and gloom, but give you the best, most balanced view that I can, and how we as families and as professionals that work with families can respond and to best help the kids that we care for and the kids that we love. So, how much time are kids on screens? Well, there are organizations, researchers who have tracked this for generations, and the largest change in entertainment screen time has actually been in the last 20 years. From the year 2000, the amount of time that young people are spending on screen media for entertainment has roughly doubled. Of course, the hours in the day have not changed, so this crowds out a number of activities, but and of course, COVID was the cherry on top of the sundae, really being forced to stay inside. There was a spike even there. So, for example, some recent data, 10 to 14-year-olds average about 8 hours a day on screen media, mostly playing video games and streaming. We'll look at what they're doing precisely, and older teens spend significantly more than that. Young kids a little bit less. But when we look at what it is that they're doing online, we look at tweens here. The vast majority, or a great majority, is watching videos and playing video games, with a little slice of web browsing, a little slice of social media. When you look at teens, it's almost the same, except you see social media has taken a bigger chunk. Far from a majority, but more. And so really, we're talking about watching videos and playing video games is what most young people are doing most of the time. Although it varies greatly by gender. Boys spend about twice as much time playing video games, for example, as girls do. So why is this happening? So I didn't hear any of you that any of you are gamers, so you might wonder why young people might want to spend 8 hours a day, either watching videos of other people play video games or playing them themselves. So I'm going to do my best to describe why. So one of the great functions of childhood is practicing to become an adult, and so pretend play it is universal among humans and of course among many animal species as well. And boys naturally have been playing at killing each other since the beginning of time, right? And here we have, you may recall the story of Ralphie, who wanted for Christmas his Red Ryder BB gun. Why did he want that? So that he could pretend, so that he could fantasize about being a gunslinger like his heroes. But of course, these days, kids are much more likely to jump on to a video game console, which depicts violence in a very sort of, graphic sometimes, but oftentimes very realistic and exciting way, while doing all the heavy lifting of imagination. So video games have really co-opted pretend play for boys, although the creative aspect is, something is certainly lost there. Also, video games are perhaps the ultimate form of escapism for young people, especially young people. A lot of the young men that I see or boys that I see who don't feel particularly successful in other domains of their life. They don't feel particularly popular, athletic, academically successful, maybe. And some of them will tell me, they'll say, I'm not good at real life. I'm good at video games. And video games, when they step into the video game world, it changes dramatically. They are the center of attention. They're the hero. They're as powerful or as, as important or successful as they want to be. And so video games are really a powerful form of escapism. And just thinking for a moment about social media, of course, there's nothing so important to teens as how they appear to other teens. And social media allows them to so carefully cultivate the image that they project, not only selecting what pictures, but of course, filtering them and whatnot. And more than that, how they interact. Many teens, especially socially anxious and depressed teens, prefer to interact with others and socialize in an asynchronous way. That means that someone doesn't say something to you and you're expected to say something right away. You get the text, you can stop and think about exactly how you want to craft your response. And that is especially attractive to young people who are very concerned with how they present themselves. Yeah, another thing about video games that I want to note is that unlike traditional forms or other forms of entertainment, like reading a book or watching a show, you can binge watch TV shows, certainly, and you can read a book in one sitting, but there's chapters and episodes for a reason, right? They're natural stopping points, and most of us take that as a cue to stop and do something different. Most video games don't have this type of stopping cue. If we look at a game like Grand Theft Auto, depending on how you define it, it could take hundreds of hours to finish the game, or it might be a game that has no finish. But typically there are no sort of natural stopping cues, which makes the time fly when players are playing with them engrossed in the game and not really thinking about other priorities in their life. And video games actually form something that psychologists call a compulsion loop, which essentially, when you're playing a video game, it actually is a little bit like work. You see, you're actually working to try to reach certain goals in the game, and you may have a lot of different goals at the same time. But let's say, for one, you want to earn enough in-game currency to buy an upgraded weapon, so a new gun, right? So you're playing the game and you're working towards that goal. You're grinding, as players called it, and eventually you achieve the goal. Now you might think, well, great, I did what I set out to do. It's time to put the game down and stop. But now you finally earned this new weapon, this new content. You want to explore it. You want to try it. You want to engage with it. And so you continue to play with this new gun. And of course, while you do so, you're drawn into other goals, like, well, gee, I'm almost enough to gain a level, or if I just had the better ammo. And so they're really, again, this compulsion loop is very hard to break. We'll see what happens when parents try to break it in just a minute. But another way of looking at things is that video games are very good at putting players in a state of flow. Now, flow, as you may know, is a mental state of being totally immersed and focused in the activity that you're doing, and it's a very reinforcing place to be, and it's sort of enjoyable. And we think about athletes talk about being in the zone, right? They're totally in, they're totally committed, or artists talk about getting their work done with the state of flow. But my theory is that nothing puts people in a state of flow easier than video games. The reason for that is that flow doesn't happen by accident. Flow happens when the challenge that you're engaging in is just the right level for you, where you have to focus completely if you're going to be successful. But if you do focus completely, you will likely be successful. And video games are unique in their ability to meet us there. So, for example, if we're doing an activity that's too difficult for us, or we can focus 100% and we're still not going to be successful a lot of the time, that's frustrating or anxiety provoking. When we do an activity that is too easy for our skill level, where we can be successful even while even just barely paying attention and the rest of our mind is free to wander, that's boring. But But in this Goldilocks zone, again, where you have to focus, but if you do, you will be successful. That's where flows is possible. And most activities have times where where you are in this zone, but other times where you're waiting around, other times where the challenge is too great. Video games keep throwing the challenges at you, and as you play the game, your skill level increases. But video games are very good at slowly increasing the complexity while your skill level increases, so that players always stay around this perfect zone of flow. And of course, players can adjust the difficulty if they need to make sure it's just right for them. Finally, video games meet psychological needs that we all have. Of course, human beings have physical needs for food and water and shelter and whatnot, but we also have psychological needs, which according to self-determination theory are autonomy, competence, and relatedness. And nothing meets these needs quicker for most boys than video games. What do I mean? Well, autonomy, of course, is the need to control the course of our lives, right? And during most of the day, kids are told where to go and what to do. And even engaging in like watching YouTube videos or Netflix, they can choose what video they want to watch. That's autonomy, and there are a lot of choices, but they can't have any real control over the flow of the action. They can pause or rewind, but that's pretty much about it, or watch something else. Well, when they're playing a video game, they have a massive amount of control over how they explore this virtual world, where they go, what they do, what challenges they want to take on, how they want to overcome the challenges, whether they're going to succeed or fail. This is an Xbox controller. It has 20 buttons on it, all of which are used during gameplay. And an average game player can press about 6 or 7 times per second, different button presses, which means that 20 to the 6th power or 7th power means that over the course of 1 second, there's over 1 million different possibilities, just to show you the incredible minute level of control that gamers have over the game. So literally no two video games are really, alike, no two modern games, because there's so much variation. So video games grant autonomy. Video games also meet our need for competence, which is we all have the need to feel effective in dealing with our environment, sort of the opposite of feeling helpless. And you would think that, well, as I mentioned, video games are very good at challenging us in a very real way, where you have to put a lot of effort forth if you're going to succeed. But doing so, you are likely to meet your goals in a very gratifying way. And in doing so, you feel competent. And, this, a friend of mine is a football coach, and he says that every year he gets a couple kids who play, Madden on their Xbox. And after playing, for a few years, they think they can actually play football, when of course, the skills often do not translate. But video games really make you feel competent, so that when my wife reached level 100 on Candy Crush, she really felt like she had accomplished something, even though I thought she had just wasted, 20 hours of her life. But video games make you feel competent. Finally, relatedness. We all have the need to feel connected with other human beings. It's sort of the opposite of loneliness. And you would think, again, the last thing someone would be experiencing while they're in a dark room by themselves playing a video game is related. But studies show that interacting with video game characters, this is not real people playing the games, it's just computer-controlled characters, actually makes players feel less lonely than if they were watching a TV show or reading a book, perhaps because of the limited interactive nature that exists. And of course, so players actually feel less lonely in the short term. And of course, games like Fortnite and Among Us instantly introduce players to others who want to either compete with them to reach the same goals or cooperate to reach mutual goals. And this is, of course, not the same as being with a person in real life, as it were, but it is a very real, if limited, connection. So video games make players feel related with one another. It may not surprise you to find that the heaviest gamers, those who spend the most time playing video games, that the gaming actually ends up being counterproductive in that way. In other words, heavy gamers feel less socially connected to their peers. They feel more lonely. They feel less competent in real world skills than their peers. Of course, they've been, spending less time doing their homework, for example, or doing a sport and more time on the game. They feel less control over their lives and less meaning in life than those who play at a moderate pace. So in the short term, video games are very fulfilling in this way, but in those who play to excess, counterproductive. And of course, these games are so engaging, and one might say addictive, precisely because they're meant to be, right? The gaming industry, for example, is a $200 billion a year industry that dwarfs the size of the film industry, for example. It's an entertainment juggernaut, and these dollars are going into making games that hook players and keep them hooked. And they use psychological principles to do so, like variable and fixed ratio reinforcement. Fixed ratio reinforcement is if you play for a certain amount of time, you're probably going to get a reward that you expect. Variable is you never know what you're going to get. You might open a loot crate and get something that is just mundane, or you might get something that is very valuable that only appears 1 in 1,000 games. So in some countries, these loot crates are legally defined as gambling, and kids are not allowed to play games that have them. Not so in the United States, however. So anyway, the games are so habit forming because precisely because they're designed to be. And so we ideally would love our kids to be able to have the willpower to control their own screen media use. And yet, if we think that they're up against this, hundreds of billion-dollar industry that is trying to hook them and keep them hooked, it might not be a fair fight for a lot of kids. So, all right, so I talked a little bit about how engaging these games can be and how difficult it is for players to stop. Well, what happens when they're forced to? One talk show host asked parents to do just that. He asked people to turn off their kids' Fortnite. I'm just going to play a minute. If you have kids who play video games, maybe you know this already, but for the rest of us, and actually, let me just make sure. I'm going to stop. I'm going to reshare and share the sound. That makes it better. Okay, here it goes.
¡Papi! ¡Ya! ¡Es en serio! ¡Papá! ¡I'm getting away! ¡Stop! ¡Stop! No! I can still win! I can still win!
Please, Matt! Stop!
Say hi, Jimmy Kimmel, and I'll turn it on.
Hi, Jimmy Kimmel!
Dad, what are you doing? I'm in the middle of Fortnite. What is wrong with you? Leave! What are you? Stop turning my TV off! What are you doing? Go cook! Stop!
Yeah, leave. Look, Jack. What do you want? Stop! Oh. What the f?
Oh, Jimmy Kimmel made me do it. Jimmy Kimmel made me do it. Oh, Jimmy Kimmel, help! Help, Jimmy Kimmel.
You just shut down my Fortnite!
Jimmy Kimmel made me do it.
No! What just happened? What the f TV?
Last one. So what did we see? We saw profanity. We saw some kids attacking their parents physically. Of course, just goes to show how jarring it can be for young people to be jolted out of this state of flow that they're in and back to the real world, and how difficult that reentry can be. So how does all this screen time affect health and mental health in particular? Well, it is complex. It is both bad and good. So if we look at, there's a number of studies that show a similar pattern. If we look at mental well-being on the y-axis and hours engaging in different types of screen media, right, we see a similar pattern. An hour or so actually seems to be positive, associated with a positive change. After that, it plateaus, and after 2 or maybe 3 hours, the more time they spend, the worse their mental health is. And of course, as we learned that, more and more kids are on this end of the amount of time spent. So why might this be? Both good and bad. And of course, with the rise in screen media time, especially over the pandemic, but in recent years, that kids are engaging in, we've seen big increases in depression, anxiety, self-harm, suicide. And there's never been so many referrals for mental health treatment as there have been over the last couple years. And this is just an association, but I strongly believe that there's been no bigger change in the lives of most young people than the amount of time they're spending on screens, and the downstream effect that can have. And we know from studies that those who are online the most are at greatest risk for these. It's not a very strong association. There's a lot of there's a lot of individual variation, but the effect size is there. So I want to talk about the good. My favorite Western movie is The Good, the Bad, and the Ugly. So I'm going to do that here. What is the good with regard to screen media use? Well, the most important is displacement and behavioral currency, as well as social connection. I do want to say video games are very good at teaching players a number of cognitive skills, visual tracking, eye-hand coordination, even vision. But the applicability, the real-world applicability of that is hard to measure. But what is not hard to measure is that with the rise of screen media, the kind of stuff that used to keep my parents awake at night is all improving. The more time kids are spending on screen media, the less time they're spending having sex, with unsafe driving, drug and alcohol use, and with violent behavior. Again, the screen media use among young people has just been exploding, especially over the last 20 years. And we've seen teen pregnancy rates decline tremendously across ethnic barriers. Similarly, we can see here motor vehicle deaths among teens, mostly because they're delaying getting their license because they're not as motivated, but we see it's less than half of what it was around the year 2000. So a tremendous, wonderful change. We're seeing big decreases in alcohol use, in cigarette use, even marijuana. There have been decreases in the last 20 years for all the concerns about legalization, although less decrease. And even there's a trend in decreased prescription drug use. Now this ends in 2016, doesn't account for the vaping craze, so that could affect these. But and some people might argue that the kids are now addicted to their games and not to drugs. But even so, this is a tremendous positive change. And finally, even though there's a lot of concern about violent video games, and perhaps there should be, what we were concerned about in the 90s when Grand Theft Auto hit the scene, that we would have a nation of violent generation who grew up playing these games, has not occurred at all. In fact, violent crime has plummeted since the 90s among adults, but among kids too. So when kids are shooting each other on Fortnite, they're not shooting each other on the streets. So this speaks to, as parents, one of the reasons that we have mixed feelings about screen media is that when they're playing away at their games, maybe we think it's not totally good for them, but we know they're physically safe, right? We know they're satisfied and they don't require a lot of our attention. So maybe we can get something done, or maybe sneak in a game of Candy Crush ourselves, right? So of course, since screen media is so motivating for young people, it can be valuable behavioral currency, and I don't think that's something that we should overlook. Social media has both bad and good associated with it. Kids, of course, use social media, connect with friends, to make new friends, and with those who are successful socially, those who have friends at school, or a number of friends who are considered, relatively popular, the more time they spend on social media, the better they feel about themselves, and the more support they feel that they have. Now, it's opposite in those who are less socially successful. So it seems like the rich get richer and the poor get poorer on social media. But for many, it is a source of self-esteem and support. It's a place that young people can practice identity and practice self-expression, which is so important in adolescent years. And for minority youth or for youth with niche interests or with learning disabilities, they can find like-minded peers online that they might not be able to find at school. So all these are very real and important benefits. Okay. Now we're going to get to the bad. Displacement is the best thing about screen media, but it's also the worst. But I also want to talk a little bit about violent media, porn, sexting, and cyberbullying. So again, painting in broad strokes, most studies have found that screen time, a lot of screen time is linked to depression, is linked to distress, behavior problems, low self-esteem, poor physical fitness. We're talking hundreds of studies. Now, not all studies have found this. And again, it is very complex. It is only one factor in many. But in general, the more time young people are spending on screens, the less healthy they are in a number of different domains. And the earlier they get an iPhone, for example, if they get it in elementary school, they are less healthy in a number of domains than those who get it later. But the biggest, I think the biggest negative, the biggest reason for the negative link between screen media and health is not that there's anything toxic about what they're doing online, it's what they're not doing. What has gone. So now that they're spending, instead of 4 hours a day, 8 hours a day on average, teens a lot more, older teens a lot more than that. What are they not doing? Well, they're not getting together in person. They're not getting physical exercise. They're not doing activities with academic value. They don't have a variety of hobbies or chores, and they're not getting enough sleep. Where do I get this information? Well, generational research has shown that they're getting together in person less than ever before. And dating as well, that the obesity rates continue to climb, that our generation has witnessed the death of reading for fun. That, when I was a kid, it was 2/3 of teens who read books or magazines on a daily basis. Now more like 1 in 7. So they're not doing this activity that obviously has a lot of value. But I think there's a value in a number of different hobbies, anything from art to music to sports to chores to to getting a job, that kind of thing. These are the things that kids are not doing that they used to, and something is lost in all of that. And it affects neurodevelopment as well. But maybe the biggest thing, the biggest link between excessive screen time and poor mental health is sleep. That young people are getting less sleep, or they're sleeping less regularly than ever before. If we look in the early 90s, the number of 8th, 12th graders who got less than 7 hours of sleep most nights, this is significant sleep deprivation. They need 8 to 10. That was 25%, already very high, and had shot up after the release of the iPhone to 40%. I believe it's even higher now. Why is that? Well, and again, sufficient sleep is crucial for learning, because that's when memories from the day are consolidated into memory. So how much of what I talk about now that you remember may have more to do with how well you sleep tonight than anything else. But sufficient sleep is also protective against obesity, depression, anxiety, suicide. It is very undervalued as far as its importance for health. And the biggest reason that screen media time gets in the way of sleep is displacement. Kids want to stay up late more than they ever have before. And that's, when I was a kid, unless I really wanted to see Arsenio Hall, there really wasn't that much to stay up late for. But now kids can do anything that they enjoy, after hours. And of course, as I mentioned before, a lot of times it's hard to stop these activities even when you intend to. Even if you say, I'm going to play my video game, turn it off at 10 o'clock and do my homework and go to bed. When 10 o'clock comes, you're in the middle of saving the world and don't know why you ever thought about that you might want to get off. But so displacement, deconditioning is another issue. When we only lie in bed when it's time for sleep, our body knows is conditioned and we transition to sleep quickly. But a lot of young people are spending their afternoons lying in bed looking at their phones, and they may decide they want to go to sleep and look away from their phone, but their body is confused because that's the place that a lot of excitement happens too for them. Arousal is also a big factor. So even when young people turn off video games and get into bed, for example, it takes 2.5 times longer to sleep than it does if they were watching a movie or if they were reading a book. And the reason is arousal. These games are exciting. They increase blood pressure and pulse. You're fighting for your life in these games. And so you might turn it off and expect that you're going to doze off to sleep, but your body needs time to cool off and your mind is still on the battlefield. And finally, blue light. Teenagers have very sensitive circadian rhythms, and the blue light in phones and screens disturbs that, essentially makes your brain thinks it's still daytime out when it's not. Okay, I want to say a word about violent video games and aggression. There are more than 100 studies, all sorts of looking at this angle, all sorts of different ways. And the great majority of them have found the same thing, that playing violent video games desensitizes to real world violence. It increases aggressive thoughts. This isn't necessarily violent thoughts, but aggressive thoughts, and less pro-social thoughts, and increases aggressive behaviors. Again, not violent behaviors, which are hard to study because they're so rare, but aggressive behaviors. This has been done in different populations in many different ways, and I really think that the research is solid. However, the effect size is small. So the effect size is about 0.15. So this is like half the effect size of an antidepressant on depression, for example. So this means that violent video games, Fortnite, is not going to make a nice, well-behaved kid into a I don't know, kid who gets in trouble all the time, or a sociopath. But is it going to move him just a little bit along that continuum? Yeah, maybe. Probably. At least that's what research tells us. Some risks about social media. I mentioned the poor get poorer on social media, and that young people who don't have a lot of friends or who are depressed they tend to use social media in a passive way. They're not posting, they're not liking, they're just lurking and looking. And this tends to have a negative effect on their mood and their well-being. And part of it is just a distortion of reality, right? That if you spend your whole day looking at social media, you might think this is what a real person looks like. Of course, when this is actually, more realistic. But people who are inclined to social comparison, which is just certain personality traits, some of us we can't help but compare ourselves to what we see. They are especially vulnerable to feeling worse the more time they spend on social media, looking at curated, social media accounts, as well as having body dissatisfaction and are at risk for eating disorders. Pornography. Our kids, if you have teenagers, they've probably seen more pornography than you have. Studies of parent and child couples have found that teenagers have seen far more porn than their same-sex parents have, and especially more types of porn and what would be considered extreme content. And parents vastly underestimated, the same parents vastly underestimated what their kids had seen. Of course, online access, it has greatly facilitated exposure, even accidental exposure, and especially by phones. So the vast majority of pornography is accessed not by computers or by tablets, but by phones, I guess maybe because the screen is small or they're portable. The kids who are spending the most time looking at porn are older, boys more than girls, those with poor supervision, those who have depression, and those who have same-sex attraction are the ones looking at the most porn. And for many, it has become the default sex education. When you ask teens and young adults, what's the best way to learn about sex? Porn is the first thing they say. But of course, and they do, watching porn changes beliefs about sex and sexual norms. And sometimes it could be a good message. So young people who view a lot of porn are actually more tolerant of homosexuality, which most people would agree is a good thing. But they also are more likely to view positively having sex with multiple partners, having casual sex outside of a relationship, and having sex without a condom, which is what porn shows, right? So it does change beliefs and attitudes about sex. And it also has the capacity to shape sexual fantasies. Even things that are that people find that repugnant can actually be arousing at the same time, and this can be very confusing. I have some patients who have talked to me about having this kind of reaction and then developing an interest over time, and this is of concern that it could lead to BDSM or pedophilia or something like that, although we don't have a lot of data to tell us what that risk is. Teens also imitate in real life what they see in pornography, especially aggressive stuff like choking or spanking or that kind of thing. Teens who watch a lot of porn, oftentimes they imagine this is normal because this is they don't have anything else to compare it to. Many teens in research studies, half have said that that their partner asked them to do something that they saw in a porn video, and many times, of course, imitated subconsciously, if not consciously. And again, teens who watch a lot of porn are more likely to engage in casual sex and condomless sex. But interestingly, the condom use is mediated by parental involvement. If parents talk to them about safe sex, that actually eliminates the relationship between pornography viewing. In other words, kids who saw a lot of porn still wore condoms if their parents told them to. Violent porn is associated with aggressive sex and even sexual assault. Boys who watch a lot of violent porn and believe it's realistic are those who are more likely to engage in sexual assault. And girls who watch a lot of that same porn are more likely to be victims, according to some studies. Now, these are just correlations. They don't prove causation, but very, very concerning, of course. And porn is associated with real world romantic relationship dissatisfaction in many different domains later in life. Sexting should be called nuding, and one thing that we need to know is it's more common than we think. Many different studies of college students show that a slight majority say they engaged in sexting when they were a teenager. Now, so it is very common. It's not necessarily a pathological behavior, and most teens don't have terrible outcomes. Most teens, the picture doesn't get forwarded around. They don't even regret doing it. And that may be because most teens sext in a low risk way. And by low risk, I mean in the setting of a pre-existing relationship. So we already have a romantic relationship, and this is just something that is a part of it. That is teens aren't very likely to regret that or to have it passed on or whatnot. Older teens are more likely to sext in this low risk way, and straight teens are as well. However, younger teens and LGBT youth are much more likely to sext in a high risk way. And this is much more likely to turn out badly for them, much more likely to feel worse about themselves, to have the picture passed on. And this is essentially sexting outside of an existing relationship. So in other words, the most common is, if you send me pics, I'll be your boyfriend or something like that. Doesn't tend to work out. Cyberbullying is neither, I won't skip the definition, but of course, social media does encourage both intentional and unintentional cruelty because of perceived anonymity, perceived freedom from consequence, and lack of face-to-face interaction. So if you really hurt someone's feelings, a lot of times you won't even know about it, and you won't be able to correct it if you didn't mean it. But so cyberbullying isn't rare, but it's not universal either. Like a third of kids say they've experienced cyberbullying, real cyberbullying, but nearly half of them say it's happened in the last month. So some kids it happens to a lot. Have an excessive share. Now girls are more likely to be both the victims and the bullies. And most cyberbullying really isn't all that serious. Now the kids will think it's serious, of course, but is not associated with any real negative outcomes. But some people are very susceptible to not only being cyberbullied, but also having negative outcomes and taking it a lot worse, quite frankly. So depressed young people for example, who rely on social media more than their peers are actually way more likely to elicit negative reaction from their peers and be bullied. And that can worsen depression and suicidality. And the ones that suffer the most are actually the bully victims. So these are kids, usually girls, that are not only bully others, but are bullied in turn. And they have the highest, the most negative mental health outcomes. What about addictive habits? Well, of course, any behavior that is reinforcing and enjoyable enough can theoretically hijack your pleasure centers and become an addiction, right? And we think about gambling addiction, of course, substance use disorder. But there is a large body of evidence that essentially that addiction to video games really looks a lot like addiction to other things, gambling, drugs, and alcohol, in terms of brain changes and in terms of symptomatology. What am I talking about? So gaming disorder is an officially recognized disorder now in the ICD, not yet in the DSM. Sorry, these are medical handbooks, but essentially it's a pattern of excessive gameplay, right, that causes big problems in your life. So significant impairment, social impairment, academic, or significant distress. And there's a number of symptoms that go along with addiction. We typically associate them with alcoholism or drug addiction, but they can and often do apply to gaming addiction as well. What are they? Number one, it takes up all your time. This habit, and with gaming, that just means you spend nearly all your free time gaming. When you're not gaming, you can't stop thinking about it. You're preoccupied with the game. You're imagining scenarios or thinking about when you can play again. Number three, loss of interest in other hobbies. You used to have a lot of things you did for fun. Now you only got one thing. And in this case, that's the game. Or in the case of socially deprived kids that I see, oftentimes they just never developed any other hobbies. Number four is withdrawal. When you can't play, you become irritable or dysphoric. Number five, you've lost control. Loss of control is a very important part of addiction. So again, this is, I'm going to turn this off at 5 o'clock, and I'm gonna do my homework, and I'm going to go to bed. But then come 12:30, you're still playing. Loss of control is very important. Number six, continued use despite knowledge of psychosocial problems caused by your use. So this could be, you don't hang out with friends anymore. You're the only one who's not dating. Your parents are on your back all the time, that kind of thing. Number seven is lies. Addicts lie about their use. And sometimes I'll meet with a teenage boy and who likes plays Call of Duty, and I'll say, how much do you play usually in an average day? And he'll look at me and sincerely say, oh, maybe 2 hours a day, something like that. And then his parents, who are sitting across the table, look at him like he has two heads and confront him on the fact that it really is about 4 times that. Lies is another common symptom. Threatens or causes the loss of relationship or educational opportunity. So this is failing in school. And usually the what I've seen with the gamers with the worst habits is something that goes like this. They start out, they're playing a lot after school, so they stop doing their homework, but they do okay in school for a while, because when they're at school, there's no video games. They focus on their schoolwork reasonably well, and they continue to do okay. Then they start staying up later, and they start being tired during the day. They're not doing their homework. They're falling behind more. So then their functioning at school starts to be poor. And sometimes they go in late because they can't get up in the morning because they've been staying up too late. After a while, they start failing, and they're miserable. They're at school. They're tired. They feel terrible. They feel like they're failing, and they are failing. And so what comes next? They start refusing to go to school, because why should I go? I'm failing anyway. I'd rather stay home and quite frankly, maybe play some games and have some fun. And then they become depressed, socially anxious, and that's usually how they end up getting referred to me. Anyway, the last one is play. The last symptom is play to alleviate negative mood. And I think that this can be misleading. This, like having a drink to alleviate, to calm yourself, it isn't necessarily a bad thing if that's one of many strategies, right? If that's one of many things you do to calm you and relax yourself, it's probably not a problem. If that's the only thing that calms and relaxes you, it's a problem. So play to alleviate negative mood. So those are the symptoms of a gaming disorder. I don't tend to like to confront the kids that I see call it an addiction because it's a way to completely turn them off. I prefer to look at, try to get them to look at how their gaming is affecting their life, because very often they don't want to see it as the problem. I'll say, okay, so you started playing Fortnite, you're doing pretty good in that, but since you started doing that, now you're failing in school and you don't get together with friends anymore, and you're depressed and your parents are angry at you. So what do you think about your gaming? And they'll say, oh, thank goodness it's been there. It's the only good thing about my life, rather than it's the cause of their issues. But that's part of the work of therapy. So who's the most likely to develop this disordered gaming, problematic gaming addiction? Well, boys, for sure. Those who spend a lot of time gaming to begin with. Those with poor social skills, like kids on the autism spectrum. Those who are impulsive and have poor emotion regulation, like kids with ADHD. And there's something about video games that appeals to kids with ADHD like nothing. They spend a lot more time playing video games than their peers. Also, those who don't have a lot of parental supervision or have a poor relationship with their parents are more likely to develop this addictive habit. And the consequences of the addictive habit, those who develop new addictive gaming also develop new onset problems with insomnia, depression, anxiety, especially social anxiety, school failure, and worsen family relations. And studies show in general what happens is parents kind of give up. They actually they start loosening restrictions on the kid because they've just had it. They feel like they don't have any control. So how do we as parents, how do we respond to all of this? Well, it's important to know that many studies have found that monitoring screen media in general works. It is not easy. The kids will not thank you for it. It can feel like a constant battle sometimes. But parents who monitor their kids' screen media, the kids sleep better, they do better in school, they're less likely to be obese, they have better behavior. And if there was any, and these are large effect sizes, and if there was a medication that could do this, can you just imagine? But I think that that and a lot of people wonder about, well, what's a good amount of screen time? And I think it really it's maybe a better way to think of it is what needs to be prioritized in the life of a young person, and that is getting sufficient sleep, time enough to be at school, and time for homework, and maybe reading for enjoyment, maybe time for meals with families, time to, some family or social time to move, and what's left over, feel free. That's what time it's healthy to play video games and be on social media. But it's really the structure and with the sleep being the biggest problem I see in the most kids. And it can be helpful to set up tech-free times, like no screens at the dinner table, of course. And the big one that I would love to see, or that I work a lot with a lot of my patients, is getting screens out of the bedroom. Two reasons. One is it wrecks sleep, and the other is that parents can't supervise it if it's when it's in the bedroom. And kids tend to isolate, and their sleep goes awry, and then depression and dysfunction follow. So no screens in the bedroom. Grandma's rule is first you do your homework and you do your chores, and I think chores are really valuable. And then the time left over, that's when you play your games. And of course, the biggest determinant of child media habits is parent media habits. And if you're like me, you struggle with your own, screen media use, but very important to role model as much as possible. Easy to say and hard to do. And to encourage positive content. Not all screen media content is the same. A kid who is, making music online or creating content, it's not the same as just sort of scrolling endlessly. So content does matter. Encouraging, of course, a variety of healthy activities is vital. And the kids that I've seen who had terrible gaming habits and really kicked it are the kids that found something else to love, whether it was a sport or another hobby. Skateboarding, I can think of. and a friend group. And of course, going outside, very, very important, but obviously this doesn't count. I'll skip that. As kids get older and as they become teens, of course, it's our job to be parents to be less of a cop, right, and more of a guide, and to help them to develop their own skills. And the ultimate goal is that they're regulating their own. So going online together, giving kids a say in what the rules are and being open to negotiation, and if possible, keeping an open dialogue about technology use and decisions, how to behave online. And the way to do that is very hard for me, and I may be hard for you as well, and that's maintaining a curious and not judgmental attitude. That, you know, we want to zoom in, we want to freak out when they tell us what they saw online, we want to zoom in and tell them the right answer, but that is going to shut down further discussion. We want to show interest in what they think. Or as they said in Hamilton, talk less and smile more when you're in discussions with your teens about these things. Of course, parents, we don't have to be perfect. We just have to be good enough, something to remember. A great book that goes over all these topics by Juliana Miner, Raising a Screen Smart Kid. It's $10 on Amazon. It's my favorite. Whenever, if you're thinking about giving a kid a new device, whether it's a video game console or a smartphone, you really get to know the built-in controls first, especially with the phones. They're not perfect. Kids, sometimes they can get around them, but they really do help. They don't replace supervision, but they really do augment it. And on PCs, there's software that does the same. And router devices sometimes can be helpful as well. Much better for the internet to turn off at a certain time in your home rather than you to go and wrestle with the video game controller with your kid. That's when you know that you're on the wrong path. When to seek help. Counseling can make a big difference. If you feel, you know, as a parent, like you really can't maintain a healthy, reasonable structure, or if you feel like screen media is, you know, causing problems with your kids' academics or with their social lives, or certainly if you're concerned about unsafe behavior. You know, sometimes when I give talk to parents, someone will say, you know, I'm afraid if I tried to control my kids' Xbox use, he would hurt me or he would hurt himself. And that's important for parents to listen to their instincts, but that's also a sign that really, you know, that intervention and change is needed. Effective treatment can include, of course, psychotherapy, medication, and important to treat comorbidities like ADHD and depression. And at NatChog, we have outpatient services all over the eastern part of the state, including intensive outpatient programs, which are a step above psychotherapy, intensive group therapy for kids, teens, young adults. There's a college track, as well as our adult and older adult programs. So help is available, and it works. Because we're late on time, I'm going to skip my conclusions, and at this point, maybe open up discussion. Any thoughts or questions?
I was glad to hear that you said that the kids can be successful after having these addictions, that they can give them up and move on, you know.
Yeah, all that focus and that passion that they can put into the gameplay or into, you know, it channel it in the right direction, and I've certainly seen that, absolutely, and it can be a wonderful thing to witness.
Right. A friend of mine, her son was addicted to video games, but it went along with a move that they had made to a new town, and so eventually he got through it.
That's good to hear. Anyone else with any thoughts or any comments or questions?
I was really interested to hear about spending time or spending screen time in the bedroom. You know, this as a kid, I was in my bedroom a lot when it was time to do things for myself, but it was reading. And I remember being warned a little bit about that from my parents, even that, you know, this isn't really where you're supposed to be doing that when you sit on the floor in a chair. So it definitely gives me some things I feel like I could start a conversation with my daughter about.
Oh, I'm glad to hear it. Yeah, and I do want to point out there's a big difference between high dopamine activities, exciting activities like social media and video games, and low dopamine calming activities like doing your homework or reading a book, which don't tend to cause the problem with sleep that that the other activities do.
I wonder if our kids are really becoming
If you have it.
socially. Oh,
Oh,
I'm sorry.
sorry.
I wonder if our kids are becoming socially, you know, I'm going to say inept, but I don't mean it to that extreme, but don't have an opportunity to, you know, to develop like empathetic skills. They're not interacting. They don't see like nonverbal communication, that kind of thing that's so critical to understanding each other. I remember going to a lecture about Adam Lanza, you know, years ago, and I know his situation is totally extreme with Sandy Hook, but that point was made that you know, if you're not aware of what is coming back to you in a nonverbal sense, then you're really at a mismatch socially, and of course with screen time and everything, you're not getting that.
Yeah, that's a great point, Julia. And it's not, you know, some of these things, if they're not learned when you're young, can never be learned. There's a critical window for neurodevelopment, and we know with a lot of these areas of the brain, if you don't use it, you lose it. So it's a concern, and we really don't know what the risks are. But there are some studies that show kids who spend the most time on screens have a abnormal brain development that they're in some ways. But anyway, I don't want to go on a tangent, but great point. Hi, Gina.
So I don't know, can you hear me?
Yeah.
Okay, I'm not used to this headset. So my issue is that my daughter will be on the screen. So she's going to be 16. She will be on the screen like from the moment she gets up, then she goes to school, comes home, like all till nighttime. I mean, it's crazy. It's like I will not allow it at the dinner table. I will, she doesn't take it to bed. That's not allowed. But you know, I don't know if she's doing her homework. I mean, she is failing one class. So obviously it's not all getting done.
Yeah.
But just because she can't be bothered turning in homework, apparently. And so it's just like this, like you never know what she's doing online. You know, like I know she has a drawing program she likes. I have no problem with that. I know, you know, it's like I don't know, you know, and she did really suffer with anxiety last year and depression. She used to be a great student before COVID. And it's been tough, you know, it's like, I don't, so she was failing 2 classes. So I do spend like an hour and a half every night, which she appreciates, but she doesn't want to do it. But she's glad I'm doing it with her. And we read that and we go over it, and she takes notes every night on that class. But it's like, so she's not on the computer then, but it's just really hard to know like what's okay. She would rather be with her friends, and she's with her friends. She's not on the computer, but it's just really hard. She doesn't like, she used to go outside all the time, and she doesn't. And, you know, it's just, but that's part of COVID too. And also my question is the posture. I'm really worried about all these kids are going to be hunchbacked. And if that has anything to do with the brain.
No, that's a great point. And I see so many kids who have back pain, and I think it's that it has a lot to do with the weakening, that if you're not moving around, your paraspinal muscles get weak, and it causes terrible back pain.
And you're like this all day.
Yeah. So yeah, I agree. I worry about that, you know, as well. But a lot of the girls that I see who are in bed on the phone much of the day, they have
right.
terrible back problems. And when I tell them they got to get around and move, that's not usually the answer they're looking for. But you're right, it can be it's presenting it like it's either a problem or it's not is way too simple. There's ways that for everyone it causes problems, and ways that it could seem that way and it isn't. But thank you for sharing.
Yes, it's hard. It's hard to know, It takes her like hours to do homework. That would probably take her half an hour, but I can't seem to peel away all those devices.
Right. Yeah, you really would love if they had, and that distraction, that back and forth. Studies show that teens think that they're doing just as good of a job as they would if they didn't have the device, but they actually do a far worse job. And I hear you. We'd really like them to make the choice themselves to turn off the device, but it keeps a close tether on all of us. Yeah.
Sometimes schools, well, I mean, back when I had kids who were 16, they do the device-free weeks or no TV week, things like that. Is there any support like that coming from the schools or from? I mean, at this point, they can't really say device-free because of COVID, so we have to be on devices. But like, maybe take a screen break or,
Yeah, I see a lot of teen girls who go to camp and they come back and they're like, it was so great. Nobody had their phones. We were all together. It was so wonderful. But they get back into regular life and things just kind of revert back to normal.
Right. They pick it right back up again. Mine were the same way. I know that when we'd get in the car, and maybe the battery would die or whatever, and I never had a charger on hand, just staring straight ahead at the road, we would just have some of the best conversations. You could get them out of the house and into the car, even for half an hour.
Yeah, absolutely. That's a great point. It helps when you're not face to face, I think.
I think that's what it is.
Well, I found with my grandson, he's 10 years old, and he's been on a tablet or a cell phone, whatever, playing games for like Among Us or watching YouTube and watching other people playing games, and which I don't understand them watching somebody else playing, but anyway, but I compromise with him, and I know that he doesn't like not being on his tablets, so they stay over my house, and I tell him, well, okay, we have to have the tablets are done by 9. Because they usually get over about 7 or whatever, after they ate and everything. And it's like, I'll go in and I'll warn them and I'll say, okay, 20 minutes, then 10 minutes, 5 minutes more, and I'll say, if you put that away, then, we'll do something I know they like to do the next day or something like that. So I compromise with something. And it's also good because it's getting them off their tablets or whatever while we're doing the activity. Like maybe it's going to the library or going somewhere. Of course, with the library, like they have the computer. It's like, oh, I want to go on the computer. It's like, well, you got to read a book first, let's read first and then you can go on, but trying to make different compromises. And the thing is, he is autistic. He's on the, he's very high functioning, but he also has ADHD, which is like really, it's really hard. But when he has his tantrums, I mean, it's really hard on him. And then he'll just like sometimes he used to hit himself and all. He doesn't do that anymore, but he's got control of that. But, and I'm always telling him, oh, you're doing a good job. You're doing a really good job, Jacob. I like the way you're doing this, or I like the way you're doing that, and sometimes he'll say, Grandma, play with me on this. And it's like, I don't know how to do these games, and he'll try and show me, but he'll play with his sister sometimes. But they have, like I said, a time limit. And, I'll remind him. And then there's just like, we'll go out somewhere, we'll go for a ride, we'll go for a walk, we'll do something that's not including any screen time, and they like doing that too. It's just that they don't always have that choice. I guess they don't think about that because, like you said, they're that zone part, and they don't think about, oh, I can go out. It's beautiful out. Let's go do something. I'll say, come on, let's go look at the garden, go work on the garden, do this, do that. With the dogs, with the animals, play with the pets, something like that. And they'll do it, but they just don't think of it. because they're so in tune to getting home, doing the homework, and getting on their devices. It's hard to get them away sometimes. So, and their mom's always like, how do you do that? How come they listen to you and not me? And I'm like, well, and I'm trying to give her the strategies. I says, you just have to compromise, let them do a little, and just remind them. Because I know if you take it, go in there and say, okay, you're done, bedtime, he's going to have a fit, and we know that. And I told her that's why you have to give him reminders, just like you do, like with a child, a younger child. He's 10 years old right now, but still, they still need the warning. I mean, and I told her, like, how would you like it if somebody came in, you were watching TV or you were into something, because she likes to play different games on the phone too, and they just took it away and said, okay, you can't do it anymore. She goes, but I'm an adult. It's like, yeah, well, still, you're gonna feel the same way. They have the same feelings, and so I try and use it. Well, I went to school for psychology, so I kind of use some psychology with her, but, and I work with youth in 2 churches that I belong to. So, it's good. I really like this, and I'm going to check out getting a copy so I can show it to other people I know. Like, showing them the website and getting them to maybe do like a group thing, where we can all look at it together. Cause I think that's good to get different experiences and all too, different.
It's a great idea, like a support group.
Exactly.
Even the kids supporting each other. That's a really good idea.
Yes, exactly.
Well, I love your ideas about the compromise and sort of giving warnings and helping kids make that transition. That's wonderful.
So I think the next series then should be about how to make sure kids can't wear their parents down so quickly, so we can really stand our ground a little better.
It's a hard one.
Oh my God. So I do want to just point out before we finish up that in 2 weeks, we will have Dr. Carrie Vargas talk about she's the head of outpatient of NATCHOG outpatient programs, of which there are many, and she'll talk about suicide prevention, which is unfortunately such an important topic these days. So hope you'll consider joining us again then.
Yeah, that'll be the same Zoom link as tonight. So it's easy enough, but if you have trouble joining, just contact me or Hartford Healthcare, maybe. I'm not sure where they could go for that, but
you can contact me if there's any issues.
Yeah.
Or you can give out my information if you'd like.
Okay, good.
Great. I really appreciate you guys all putting this together, because this is really, I feel, really beneficial. Even though I have some strategies, it's always good to see other things, and learn more.
It really is. It's
really
helpful to know other people are dealing with it.
Yes.
I'm going to get that book for our library, Marie, if you're in the West Hartford area, or we can even mail them out to, if you want to borrow it we can mail it to you.
Yeah, I'm in Britain, but they're pretty good there too. So yeah, I can check it out, and then we can always have them. If I could always have them send it if I don't get my own. I buy a lot of books from Amazon, so
it's a fun read.
Don't we all? Yeah. So, thank you, Dr. Paul. That was really fabulous. Really helpful. Thank you.
My pleasure, and thanks everyone for coming. And I really appreciate the great comments.
Thank you.
Thank you.